Cranial nerve classification based on function, from the teachings found in Gray's Anatomy for Students 3rd edition. If you think about a cranial nerve, it can be classified as general, meaning that it has a general function, or special, meaning that it conveys a special sensation like smell, taste, hearing, or balance. They can be considered somatic if they're related to the body wall, for example, skin or muscles, or visceral if they're related to the gut. They can be afferent if they're sensory, or efferent if they have a motor function. So if you make 3-letter classifications from each of these categories, you could have a general nerve that is related to the body wall and has a motor function, and that nerve would be considered a GSE nerve. You can continue to do this with each of the 2 categories and make 3-letter combinations and come up with 8 different possibilities. So you could have, in addition to a GSE nerve, a GSA nerve, a GVE nerve, which remember is sympathetic or parasympathetic, and lastly, a GVA nerve. These 4 classifications are essentially what spinal nerves are. They're mixed fibers of these 4 different types. When we talk about cranial nerves, we add the special sensation category, and we can come up with 4 additional options. The SSE option does not exist. In Gray's Anatomy for Students, the SSA and SVA categories are combined into an SA function, and the SVE is termed BE, which stands for branchial efferent. These fibers are motor in nature, but they serve tissues that did not arise from somites. So if you write out the Roman numerals for each of the 12 cranial nerves and you use the mnemonic, some say money matters, but my brother says big brains matter more, and you take the first letter of each word of that mnemonic and apply it to the 12 cranial nerves, you can come up with something that looks like this. And now there's 6 rules that you can use to classify the 12 cranial nerves based on function. The first rule is that all of the nerves that have an S next to them will have an SA-only classification. The second rule is that all of the nerves that have an M next to them will have a GSE classification. The third rule is that all of the nerves that have the letter B next to them will have a BE and GSA classification. Now the remaining 3 rules add to this. The fourth rule is that the parasympathetic cranial nerves will have to have a GVE function. Remember that the parasympathetic cranial nerves include cranial nerves 3, 7, 9, and 10. So we'll add GVE to those 4 nerves. The fifth rule is that we're going to add SA to cranial nerves 7, 9, and 10. And the sixth rule is that we're going to add GVA to cranial nerves 9 and 10. Now notice that in rules 4 through 6, there's sort of a waterfall effect where we're talking about 3, 7, 9, and 10, 7, 9, 10, 9, 10. You can use that to your advantage to remember those last 3 rules. If you want to take it a step further and reclassify the cranial nerves that have SA next to their name, we can classify the cranial nerves that are related to vision and hearing and balance, so that would be cranial nerves 2 and 8 as SSA. Cranial nerves that are related to smell and taste are going to be classified as SVA. So cranial nerve 1 would be related to smell, and then cranial nerves 7, 9, and 10 all are related to taste. If we want to talk about the parasympathetic components, we can associate those with ganglia. So cranial nerve 3 has a preganglionic parasympathetic cell fibers that will synapse within the ciliary ganglion. Cranial nerve 7 has preganglionic parasympathetic fibers that will synapse in either the pterygopalatine ganglion or the submandibular ganglion. There's 2 different pathways for these ganglia that you'll need to know. Cranial nerve 9 is going to carry preganglionic parasympathetic fibers to the otic ganglion. And lastly, cranial nerve 10, the vagus nerve, is going to carry preganglionic parasympathetic fibers to, let's just say, glands below the hyoid bone. There may be some argument there, but we're not going to talk about the ganglia because they're not related to the head.